Hi, my name is Dr. Viral Desai. I am a cosmetic and plastic board certified surgeon and a hair transplant surgeon with special interest into hair loss. We've been treating patients for over 21 years across the country. We are a part of a global chain. We have more than 80 clinics globally and more than 18 clinics in India. I'm based in Mumbai and Pune, and I'm going to be talking about one of the newest therapies which I'm proud to say that we introduced in India around 2 years back, which is called exosomes. What exactly is exosomes? Let's understand regenerative medicine. We know about hair transplants, we've read and there's a lot of literature about it, but what about regeneration? In the initial phases of hair loss, when the hair root is getting thin, when the stem cells are getting weak and the hair is becoming weaker and weaker till it falls off completely, okay, and then you need to put a new hair follicle which is called as transplant. At that stage, before the hair follicle falls or dies off completely, you can use regenerative medicine. You can use things to actually stimulate the root, to make it stronger, to stimulate the stem cells or their products to actually regenerate the follicle. And that is regenerative medicine. Exosomes is a part of this regenerative medicine that we see today, and this is the latest that we have in offering with great results. I was introduced to this in an international conference in Paris, and then I got it to India, and I was the first person to use exosomes around 2.5 years back, and now a lot of patients are using it. A lot of doctors across the country are interested in using exosomes. Proudly say that I was a pioneer of exosomes in India. Now, what do stem cells release? Stem cells release these so-called vesicles which have mRNA, rRNA, growth factors and various other components in them for stimulating other cells. So these vesicles, tiny vesicles that are released by the stem cells are the exosomes. The exosomes can be animal origin or plant origin. They can be ectodermal origin or mesenchymal origin. Okay, they can be actually taken from the tissue or they can be made in the lab from stem cells. So these are the various sources of the exosomes. They are available in these vials which are freeze dried. They have to be mixed and activated and then injected or rolled into the scalp or applied on it. Exosomes have been used for burns, for scar treatments, for anti-aging, etc. and they work beautifully. But when we use it for hair, what it actually does is it increases the number of stem cells and the functioning of the stem cells at that site so that the stem cells become better. It improves the blood supply to the scalp. It goes and stimulates the dermopapillar layer, which is the main thick layer where the anchoring of the hair follicle occurs. It increases protein synthesis. Proteins are required by the hair. In fact, most of the hair follicle is full of proteins. Okay, it increases the collagen in the hair. It increases type 3, type 1 collagen. It increases transferrin into the hair. It increases the oxygen uptake by the hair. It prevents oxidative damage to the hair. It also helps to remove CO2 and other impurities from the hair follicles. So this is how exosomes work. Now we all know about PRP and GFC. So what PRP does is platelets which have growth factors which are released there go and stimulate stem cells. And these stem cells actually release exosomes which improve the cellular mechanism and the functions of the cells. So rather than stimulating it indirectly through these growth factors, we now directly take the exosomes. This therapy typically needs to be done 4 to 6 times at a gap of 2 to 3 weeks. Each treatment will take around 15 to 20 minutes. It's completely painless. You can go to work immediately after the treatment. You can do all your activities immediately after treatment. All you need to do is not to do physical activity for 12 hours and you don't wash your hair for 6 hours. That's it. There is no other restriction. You can go out immediately if you want. So this is how simple it is. You do it 4 to 6 sessions and then you repeat it every 3 to 4 months. So do it around 3 times in a year in order to keep the effect, because the effect will start fading in 3 to 5 months approximately. Now at present, it may be a little more expensive than other therapies, but also it's very, very effective. The other big advantage of exosomes or many other therapies is that the effect is immediate and you do not rely on platelets or other growth factors, but you get immediate results. Platelet PRP takes 1 month to 2 months to show results. Exosomes show results within a week or 2 weeks, and the results also last for quite a number of time. So to educate yourself, for these kind of latest therapies which are available and which we keep introducing in our clinic, do follow our channel, like, comment, share this video, educate others, educate yourself, and follow our channel to know this and much more about hair loss and hair transplant.